Hi, Unit 5 families. My name is Susie Markham, and I'm the chair of the Unit 5 school nurses. And the Unit 5 nursing team and the district office have joined together to present this video to you that is going to hopefully help parents to know what to expect when your child returns to in-person learning. So the Illinois Department of Public Health and the Centers for Disease Control have issued new protocols that schools must follow. So these are mandates coming from these organizations. So hopefully this presentation will help you to know what to expect in the 2021 school year with our new protocols. And we are asking that you partner with us in order to follow these protocols to keep everyone at school safe. So the first mandate from the Illinois Department of Public Health, or IDPH, is that parents are required to certify daily that your child has no symptoms of COVID-19 and also that they have had no exposure to someone who has tested positive to COVID-19. Unit 5 will be using a new app called Unit 5 Safe, and we are asking parents to, every single day that your child has in-person learning, to go into the app and certify that your child is symptom-free and also exposure-free. You will be getting more information soon about this app. So this includes taking your child's temperature every day before school. Many schools may push out some reminders for parents to do this, like maybe a school reach phone call or a text. But ultimately, it is parents' responsibility to make sure that you are doing this each day for each one of your children, each day that your child attends an in-person learning program. If parents forget, your child will be removed from the classroom until we can take their temperature and until we can make sure that they are symptom-free and exposure-free. So for elementary students, this is going to include a phone call home. So we just ask that parents take care of all of this before your student comes to school. It's very important. But also we are reminding parents that we need to make sure and have up-to-date contact information for you, and then maybe several emergency contacts in case we can't get a hold of you. Per IDPH mandates, if your child has any one symptom listed here, they must be sent home and they need to be picked up from school promptly. Or if they have this symptom before school starts, we're asking that you keep them home. These symptoms include fever of 100 degrees or over, new onset of moderate to severe headache, shortness of breath, new cough, sore throat, vomiting, diarrhea, abdominal pain from unknown cause, new congestion or runny nose, new loss of sense of taste or smell, nausea, fatigue from unknown cause, muscle or body aches. We know these symptoms are identical to many other illnesses like the common cold or influenza. But unfortunately, there's really no way to know if a person has COVID without testing. And that's why IDPH repeatedly says that medical evaluation and testing are strongly recommended for all persons with COVID-like symptoms. So in order for us to keep our schools safe and open to in-person learning, we have to follow these guidelines. Again, please make sure that you have quick contact information and that you are able to pick your child up promptly if we do call. If your child has a chronic condition, and you would like for us to take that into consideration on whether or not we're going to be sending them home, then we will be requiring a note from your healthcare provider. Okay, a doctor's note is not a guarantee that your child will be able to remain in school. It's just one of the many factors that we will be taking into consideration, like taking a temperature. This would include some sort of note that you've turned into the school in written form. Maybe the doctor put this on a physical exam form, or maybe there was just a random note that said that your child has seasonal allergies from your healthcare provider, or maybe it's on a medication form. Parent documentation of a chronic condition will not be accepted. So if your child has a chronic condition and you would like for us to take this into consideration, we are asking you to reach out to your doctor now and just ask your doctor to write a note in case you're wondering if there is documentation of that in the health file at school. Reach out to your doctor now and ask for an updated note. And we are asking for you to make sure that your doctor lists typical symptoms for your child. So if they have seasonal allergies, list exactly what those typical symptoms are. And we kindly ask that you accept the judgment of the school if you are asked to pick up your child. Our job is to keep all students safe in these very uncertain times. Another IDPH guideline is that if a student gets sent home from school because they are sick and it's not due to a chronic illness, all siblings and household members must be sent home as well and may return to school when the sick student has met the criteria to return to school, which we'll go over in the next slide. Again, this comes from IDPH mandate. This is not a Unit 5 guideline. This is mandated. And this is only for a person with COVID-like symptoms and no known exposure to a positive case. Students and staff with known exposure to a positive case would already be in quarantine. So the 3 criteria that must be fulfilled in order for a student to return to in-person learning are, number 1, you must have a doctor's note with an alternative diagnosis or a negative COVID test, or the student will be excluded from school for a minimum of 10 days. So this isolation also must include that the student is fever-free for 24 hours before returning, and also all other symptoms have improved, all right? If your student is sent home because they are sick, or if you've called them into the attendance line, you will also get a phone call from the nurse if you've called them into the attendance line. And if we are sending them home at school, from school, then you'll get a written detailed note with these 3 options from the school nurse. And the school nurse will go over this with you again. It is extremely important that parents call the school if your child tests positive to COVID-19 or is deemed a close contact to someone who has tested positive. The school will then work to determine who are the close contacts here in the school setting to a positive case. The McLean County Health Department will also be in contact with you if your child is either has a positive case or if they are a close contact. For returning to school, we just want to make sure that you know if you take your child to the doctor to get an alternative diagnosis or a COVID-19 test, you must provide proof to the school that that has happened. You can scan and send that in an email. The health department and testing agencies for COVID-19 also provide an electronic copy of that you can forward to the school, or your child needs to come with a paper copy before they can return to school. If you do choose to isolate your child for 10 days, please check with the school nurse to see what documentation is needed before your child can return. We understand that this is a lot of information that we have provided in this short video, but we just want to remind you that if you have any questions at any time, you can always reach out to your school nurse. So all of the sick day guidelines that we just discussed are extremely important, especially since those procedures have changed because of COVID. But we just want to remind everyone what we're doing on the front end. So making sure that everyone is wearing their mask and that the mask is covering their nose and their mouth. This is such an important thing to cut down on the spread of germs in schools. We are going to be making sure that students are washing their hands. And we have several hand washing videos that I have made to push out to the students to make sure that they are washing their hands in the proper way. We are also making sure that students are keeping 6-foot distancing as much as possible. All of these guidelines, in addition to our new sick day guidelines, will hopefully help to keep the students and staff in the Unit 5 schools safe, because we just want everyone to remember that we are all in this together. Thank you.